adaptation cost, so that we can really integrate this adaptation cost into the social cost of environmental hazard, not only like the direct health and economic impacts, but also the adaptation part. And we have some existing approach to quantify the adaptation cost. And the first type of approach is we don't need to like kind of have that observe all the adaptation margin and also observe how people are really making their adaptation to quantify the cost. And sometimes the data challenge would be severe. So the recent literature, they kind of promote a way to implicitly account for adaptation. So how do they think about this problem is that under a microeconomic model, like decision-making under risk, assuming that people are optimizing their choices, and under Avalov theorem, we would have like marginal adaptation cost equals to marginal adaptation benefits. So although we do not directly observe adaptation cost, we sort of observe adaptation benefits that can help us to inform, like people, if people adapt to an extent that adaptation cost equals to adaptation benefit, we can use the adaptation benefit as a way to inform the cost. And how do we observe adaptation benefits? For example, like some literature recently arguing that with extreme temperature as example, if people adaptation is as a function of the average temperature of that locality, we would expect for places such as Houston, people will adapt to a higher extent because the extreme temperature issue is more severe at Houston compared to a mild place such as Seattle. So we would expect, also people empirically find that the mortality cost associated with extreme temperature, like a day with temperature above 30 degrees centigrade, is much larger in Seattle compared to a place like Houston. That is because people in Houston might already adapt in some way. So the adaptation benefit would be like the reduced mortality. And that kind of, if people are making their optimal decision, we can think that also tell us about the potential adaptation cost people use. And that, of course, is less demanding in having to find data on people, what kind of adaptation people are actually doing, but it's rely on the heavy assumption that people are making optimal adaptation choices. We know that it's unlikely to be the case when there are information and behavior biases, particularly in lots of developing countries and for people with lower socioeconomic status. And there are literature also on like if this assumption does not always hold, what about we directly measure how much people spend on adaptation? And the most promising direction and what like influential research to date are like quantifying defensive expenditure people spend, like face mask, air purifier, how much people spend, and to inform that the adaptation cost. And limited attention to date are paid to like the widely adopted non-market adaptation. So this behavior, for example, people reduce their outdoor physical exercise, is very widespread and also directly written in policy guidance, but to this are paid like very little attention to this kind of behavior and to think about what kind of cost we can think about related to this type of adaptation behavior. So for example, this is the ambient air quality standards in China, published by the Ministry of Environmental Protection and now the Ministry of Ecology and Environment. We can see that for the AQI would be air quality index, they put that into different category, and that would be like excellent to good. And as the AQI level increase, the pollution category will come like medium, heavy, or severe pollution. And for like when it's above 100, when it's light pollution, the recommendations say that like children, elderly, and people with cardiovascular or respiratory diseases that are kind of vulnerable population should reduce long time and high intensity outdoor exercise. And when it's medium pollution, and normal people should start to properly reduce their outdoor exercise as well. And when it's heavy pollution, the recommendation said like vulnerable people should stop exercise and normal population should reduce outdoor exercise. So we can see like the whole guidance are heavily centered around reducing outdoor activities, because with a higher inhalation rate, outdoor physical exercise substantially increase the amount of pollutant people inhaled, thus substantially elevates the health consequences associated with air pollution. So this suggestion makes sense on that front. But we all know that physical inactivity is not it's not like free lunch as well. Physical inactivity also leads to a lot of like obesity, diabetes, cognitive impairment, and a lot of diseases. It's also one of the leading cause of death on a global scale. So like there's a health spillover from protecting people from one environmental hazard will cause people to might have some more issue, general health costs in another type of diseases, which this part should be like more thoroughly understand. But before I proceed, see there's a chat questions that, okay, it's not related to this. So like, if there's any question, just type in the chat and I will try to answer that for the clarification. I can actually see that on the screen right now for the chat box. Okay, so with growing awareness of the health impact of environmental hazards, we know that adaptation will become more and more prevalent. So this research intends to help us to better understand how do we quantify the costs associated with non-market lifestyle adaptation. And under this large question, I will use a case study with air pollution and outdoor physical exercise as a specific example to try to understand in answering following specific question, like what data can be used to observe this behavior trend related to more general lifestyle adaptation. How do we quantify the magnitude of behavior change causally attributed to environmental hazard like air pollution? And how do we measure the cost associated with this adaptation? And finally, what are the kind of equity implications if we rely on private adaptation? Like not only its general cost, but it's also general inequality issue. And what are the equity implications for this kind of adaptation behavior? And a quick summary of the results, I'm gonna find that I will use a novel data set of like 27 million exercise records from a cohort of 250,000 individuals from one of the most popular fitness app in China. So through this data set, I could observe the same individual over time so that I could really see their different behavior on this with more heavy air pollution and clean days so that I can use like leverage its individual level variation to remove a lot of omitted variable bias. And I will also use an instrument which commonly used in this air pollution related literature to account for the endogeneity of local air pollution. I would use like the wind direction from upwind cities and also the pollution transported from upwind city as the IV for local air pollution. And I have several findings. First of all, I found like air pollution significant impact people's outdoor exercise likelihood. Like when it's reached heavy pollution level, like 200 in AQI, it's reduced outdoor exercise by about 28%. And I found that information plays a vital role in moderating this behavior because I found a discontinuous reduction around the government designated heavy pollution threshold, which is like 200 in AQI, compared to the pollution level right below and right above. I use like RDD, regression discontinuity design. I found a substantial reduction around the government designated heavy pollution threshold, suggesting the effect of this information. And I also found another like issuing pollution alerts in advance also change behavior a lot. It really doubles people's adaptation. So the information is a very important moderating factor in how people adapt. And I'm gonna document persistent inequality by different education groups. So people living in like well-educated neighborhood are much more likely to reduce their exercise behavior in response to air pollution compared to people in like less educated neighborhood. And I use a survey evidence to show that awareness of pollution and health impact is likely to be the key mechanism underlying this adaptation inequality. And finally, I did a very back of envelope analysis to try to understand the health costs associated with reducing physical exercise. And that is about over 0.5 billion US dollar health costs per year because people reduce physical activity, they're being more inactive, and that can lead to other health outcomes. I use some evidence from previous literature coupled with my results to do this very back of envelope cost analysis. And this related to several strands of literature, like for the literature on air pollution of health, there are lots of literature, as I have mentioned before, documenting the causal impact of air pollution on cardiovascular and respiratory diseases, I contribute to this literature by improving our understanding of the linkage between air pollution and potential pollution irrelevant diseases like diabetes, obesity, cognitive impairment, etc. Provides like a behavioral mechanism which could explain like why air pollution could also affect like broader health outcome than just cardiovascular and respiratory diseases. And secondly, there is a growing thread of literature on avoidance and adaptation behaviors. And I listed several here in the context of air pollution. There are also a lot of growing understanding of adaptation to climate change. I add in evidence of one of the most health relevant avoidance behavior, which is physical exercise with individual level panel data that have some advantage over like location specific data, like visitation to park, visitation to zoo. This individual level data really allow me to control for compositional effect and controlling for a lot of unobserved individual level confounders. And finally, this research also relate to the broad literature on environmental justice. But I want to add to this literature by providing evidence on how awareness of pollution health impacts can actually contribute to environmental inequality of like people of lower socioeconomic status, because like lower awareness in pollution health impact cause them to less likely to adapt, which can also generate environmental inequality. And this matters because currently our valuation of people's willingness to pay for pollution reduction mitigation, they usually say that observe how much people spend, and that kind of need to rely on like perfect information. If there is awareness difference and gap in awareness of pollution health impact, it means that using this type of measurement to measure people's willingness to pay is likely to undervalue how much people prefer for this lower socioeconomic people of lower socioeconomic status. And these are like the background of this research. Without further ado, let me talk more about one of the special thing about this study is the data set. I have 27 million exercise records tracking 250,000 users over time from one of the most popular fitness app in China. And this app have over 100 million users registered in 2017 and was constantly expanding over time and also expanding to even other countries. And for each individual, I observe their reported registration location, observe their birthday so that I know their age, observe their gender, their weight, when they join this app, how many people are following them, how many people they follow, because this kind of, if you also have a kind of social media nature, you can follow others to see how others are exercise. You can also be followed by others. And for each exercise records, this would be a unique thing is that for this data set, I observe very detailed exercise information. So for each exercise record, I see what type of exercise they've done. They do like running, hiking, cycling would be outdoor exercise. I also see like yoga would be indoor, of course, and normal would be the type they follow in the video to do like Zumba or the weight training, like different type of exercise that they follow the video of the provided by the app to do certain type of exercise. It's also usually considered as indoor exercise. And beyond the type, I know the exact time people do the exercise, like 8 a.m. on January the 1st. Like I know the duration they do the exercise. I also know the geolocation and also the distance if it is outdoor exercise. And people sometimes also text some messages. The text means people sometimes also share their feeling or share some words when they text their exercise. I also can observe this. But I want to be very frankly and mention upfront that I mentioned this app have sort of a social media nature, which means that people need to make it public viewable for me to be able to observe their behavior. So what this app usually do is that after you do the exercise, you click finish, there will be a summary page showing you like the duration, how much calorie you burn, distance, etc. So it's kind of summary information. And once you click post and to finish, it will like by default, this exercise record will be shown on the main page of your exercise app personal main page. And you can choose to hide that by making this post only viewable to yourself or not post it at all. So if you kind of choose to do that, it will be a selection issue happening here, which I only observe public viewable posts instead of all the private posts people might have. By default, this app will let you to post it on your personal main page. So it's kind of the default effect might reduce the selection issue, but the selection issue might still exist, and I do not have a perfect way to solve it.
So, Yichu, one clarifying question about, so this is a mobile phone app. And
yes.
for you to be able, well, first of all, is it free? I don't know if you mentioned that. Is it free to use, or do you need to pay for it? And second, is it one of those where if you go around running, you need to bring like a bracelet or something that tracks, or like a smartwatch to track your movement, or you track it through actually bringing your phone with you?
Yes, great question. First of all, it is free to use, so you don't need to pay to use this app. And secondly, you can choose to wear. Recently they kind of have more product you can wear it, but definitely by 2017, at that time people mostly just bring their phone with them. So they also track the trajectory, track the distance through the GPS of their phone instead of having a wearable to count step counts, etc.
And given the social media or social network nature of the app, do you fear of, false reports of exercise, of people saying, I'm exercising and they're not exercising? Do you need to double check that the movement of the phone, for example, matches what people are reporting, or do you only go by the report?
I know their trajectory. I know the distance they run. I know where they started. That's kind of automatically tracked by the GPS of their phone instead of the report I run for 1 kilometer, for example. So on that front, it should be relatively valid compared to people just survey or just tell others how much to run. There might be more detailed validity check to see that maybe on certain days people will run less, but will still post. So I also have some analysis on the more intensive margin analysis. So beyond whether people exercise or not, I also done some analysis about their speed or the duration, etc. So hopefully that could kind of speak to this intentional posting behavior to show their exercise. Not actually doing that.
That helps. There's a question by Unji.
Hi, Jen.
Indeed.
Thanks for interesting presentation. So I have a question about this. I found the inequality aspect that more interesting, but I was thinking whether you differentiate this indoor versus outdoor activities, because I think potential cost of outdoor activities is higher than benefits if the air quality is bad, but also that affects the inequality aspect because those who are having access to indoor facilities tend to be maybe higher income people. And also I'm a little bit worried about the selection issue, related to Louis' question, that those are using this app are more likely to be health conscious people. So maybe the part of the people that you're picking up might be very specific population. So I guess the external validity of the data set.
Yeah, great question. For indoor, I do distinguish indoor and outdoor, and the main analysis I conduct related to reduction in outdoor exercise. I also check indoor, and I will show you pretty soon. I found very limited indoor exercise response, so no reduction, no increase. So kind of indoor exercise does not respond to air pollution at all, according to what I can observe in this data set. And that's kind of, I also show that by different education group also observe no indoor substitution. Because you can observe people maybe substitute indoor exercise as well. If they think outdoor is so polluted, maybe I switch to indoor, and that will also have a health implication. But in the context of China, I did not observe indoor substitution, and I will go over that pretty soon. And to think about how this research applied to the context, like more Western context, when indoor exercise are more like dominant and prevalent, that kind of things would need to be taken into account. Like this study is related to China, if extrapolate to other countries, that might be an issue and need to be recognized of. And for like the selection about the health aware, so this is something I like cannot directly address. I have done several analysis. Maybe I can extend some analysis showing like people with different exercise frequency. So I can know like people maybe register, but they exercise relatively rare, or compared to people who like use this APP a lot. That's kind of within the APP, I can observe some differences in health awareness. But if we compare this to like more general population, the thing I have done is that I checked the age composition, education composition, etc. with the general census. And what I do is I found like clearly the sample are more concentrated for people within 20 to 40 years old. Like smartphone APP, you might expect that. It's definitely oversample people with between 20 to 40 years old. For people below 20, like for adolescents in China, they usually have like physical exercise courses, so they do not rely on this exercise APP to do their exercise. And for people elder than 50, they kind of are less digitalized. Like for other social media platforms, we also observe like the similar issue. So it's oversample people within 20 and 40 compared to the general census data in China. So what I do is that when we try to understand the health cost, I will reweight the sample size according to the age composition of census, so that for people relatively underrepresented, I will give higher weights when I calculate the health cost. And I found this actually have very limited effect on this magnitude of health costs measured associated with physical exercise behavior. This is like within the sample, this is all the thing I can do, like whether these people twists are more health aware, like I do not have a direct measure to test, and if there are any sensitivity I can do, I'll be very open to that.
Awesome, thank you.
Thank you, Yichu. And I also couple this data set with, of course, air pollution data from like the 1,500 official pollution monitor station all over China, and I measure AQI, air quality index, measure PM 2.5, ozone pollution. And I aggregate to the city-state level, but only focus on daytime hours, so 6 a.m. to 10 p.m. So if heavy pollutant only in the nighttime, that will not be considered, since I don't think that will affect people's exercise behavior. And I also collect detailed meteorological data from like 2,000 national meteorological monitor stations. So I control for like information on temperature, precipitation, humidity, wind speed, wind direction, air pressure, and cloud coverage. So this kind of weather data are hopefully that kind of enough weather data can control for some weather confounders. And I do not directly observe people's income and education because they do not report that on their exercise APP. So what I can do is that I only focus on people who their reported registration location are consistent with the custom exercise location, because I know the geolocation of where they exercise. When they are consistent, I will keep them in the sample. And when I merge with neighborhood socioeconomic data, I use people's custom geolocated exercise location to pin people on different neighborhoods. And for each neighborhood, I have the average year of education. I also collect the housing wealth through like housing price data collected from Lianjia, a real estate platform in China. And neighborhood, I can go to 街道 level, which is the smallest neighborhood, similar to like the census block level. But this is like neighborhood level socioeconomic proxy instead of individual self-report their individual socioeconomic status. And this is brief summary statistics, and we have like about 250,000 observations at individual level, and when we like to that individual and date, so to exercise level, on the average air quality index would be about 70 for all individuals in all city in the entire year of 2017. And on each day, there are about like 16% of people doing exercise. And the empirical strategy I do is start with a fixed effect model. I have like y variable would be like a dummy variable measuring whether this individual conducted any outdoor exercise on a specific date. And the pollution would be like the average air pollution level in the city on that city and for that day. And I control for like temperature and other type of weather control I already mentioned in the data section. I also control for holiday dummy indicator of important national holidays. And I control for day of week fixed effect to control for like weekly variation in exercise, and city by month fixed effect to control for like city specific seasonal variation in exercise. And most importantly, also control for individual fixed effect so that I really track a same individual over time to see how their exercise behavior change on this with different pollution level. And to account for the endogeneity, I adopt a metrics which are kind of already quite widely adopted for this air pollution related literature. I instrument local air pollution by imported pollution from upland cities. And I do not have an exact atmospheric model to model like the accurate amount of air pollution transported from upland city. What I do is I build kind of this using this equation. So as long as satisfy like relevance and exclusion restriction, it will still be a valid IV. And the imported pollution from upland city will be positively correlated with the pollution level in the upland cities, positively correlated with wind speed. So higher wind speed, more pollutant will be transported, and negative correlated with distance. So if like farther away the two cities, the less pollutant will be transported. And at times that with a cosine value of the angle between the wind direction and the line connecting these two cities, so the city pair, that is basically mean that if the city is directly on the direction of upwind direction, and then that city will have higher contribution to air pollution for city A would be the city of interest. And beyond that, I exclude city like city E, which lies within 100 kilometers to the city of interest, because they're likely to be a correlation in local activity as well. And also exclude city like city D, which are like more than 300 kilometers away. So it's kind of too far away for the air pollution to be transported.
And Yichu, one question, and you haven't worked with air pollution data, but does the same happen with clean air? Do you have, you know, cleaner air moving from moving upwind and making your air pollution lighter?
I guess it's kind of move in the same direction, right? So if you think a clean air would be up when cities PM 2.5, maybe 5, and if it is polluted, it would be like, for example, 500, and right. That's kind of like if it's 5, the transported pollution would be smaller, and so that kind of reduce local pollution.
And that would also be, so your instrument is a continuous measure basically of the pollution, yes, in upwind cities.
Yes.
Okay, so it's not below and above the threshold of, yes, the warning that you were mentioning, yes, before.
Okay. Yes, it's all continuous measures. Thank you for that. And so for the results, I kind of found, are there any questions here?
Yeah, there's one question in the comment. Maybe I can address it in the end. I think it's not directly related to the IV. Okay. So the results I found is that 1 unit increase in AQI reduces one's excess likelihood by 0.14%. What does 0.14% mean? Put that into perspective. A 1 standard deviation increase in AQI would cause 5.7% reduction in outdoor exercise likelihood.
And if a 200 increase in AQI with heavy air pollution will cause 28% reduction in outdoor exercise likelihood under this kind of linear and marginal effect model. So where I'm looking at this like AQI impact, and we also observe like similar impact for PM 2.5 when like higher PM 2.5, lower tendency to do physical exercise. And this effect size is quite large when compared to like previous literature on visit to movie center, visit to restaurant, to zoo. 28% reduction is one of the largest magnitude compared to other literature. And because this physical exercise is really more health relevant behavior than like you're just doing like normal outdoor activities. So this might explain why like this research find like higher magnitude than previous literature, and also it's have a individual level data, so it's kind of different, could be different from the previous studies. And this is physical exercise, it's just extensive margin. Of course, like Inji also asked about that, there could be a lot of other margins people respond. So except reducing physical exercise, they could change their exercise duration. And what I found is that indeed people change exercise duration, but the magnitude is very small. So heavy air pollution caused like 1.4 minute reduction in exercise duration. So it's a relatively minor magnitude, although it's statistically significant. And another margin would be exercise intensity. I found people mainly reduce exercise for running. For cycling and walking, the exercise activity was not affected that much. And they also have a marginal effect on exercise speed. I measure percentage change in exercise speed. And to put that into perspective, like heavy air pollution can cause 2 to 4% decrease in exercise speed for running and walking. And compared to 28% decrease in the exercise likelihood, so extensive margin is still a much more prevalent adaptation margin than like reducing duration or reducing speed. And perhaps more importantly, it's about the indoor exercise. Do people change, like reduce indoor exercise, or like if people switch to indoor exercise as a way to self-protect, it's actually reduce the health costs associated with like physical inactivity, because people might have indoor venue to do the exercise. And what I found is that for all the indoor exercise type like yoga, Zumba, weight training, or all the kind of indoor type of exercise, I found quite precisely estimated non-effect for switching to indoor exercise. So the indoor substitution is really not very prevalent according to what I found in this data set. So the main adaptation margin is people reduce their outdoor exercise. And I also tested the results are not driven by correlation with other pollutants. For example, ozone, which I kind of correlated with PM 2.5, and I kind of this showing that the AQI, air quality index in China, are determined by the primary pollutants. So the pollutants are most important, most highest on that day. And for 90% of the cases, particulate matter is the primary pollutant. At about 10%, about 9% of the times, ozone serves as a primary pollutant. And so I also test the effect for ozone. What I found is controlling for ozone, first of all, no matter controlling in the way of ozone itself or instrument ozone, there are still like very significant impact of PM 2.5 on outdoor exercise with very similar magnitude than what I found before. So ozone is not really changing the effect for PM 2.5. And perhaps also interestingly, I've observed that people, when we don't instrument ozone, we actually found a positive correlation between ozone and physical exercise. It's likely due to like ozone tend to be higher on days or it's warmer or like sunny, and this might not be sufficiently controlled for in like the weather control, or there might be another like local activity which correlated with local ozone level. But if I instrument ozone from like transported polluted from upland city, the similar IV construction, I found like that people are not really responding to ozone pollution like the way they respond to PM 2.5.
Yishun, there's a question by Dong Xiao. I don't know if you want to look at it or if she wants to unmute.
It's the APP.
Hi, Yichu.
Oh, hi, Dong Xiao. Yeah, you can directly ask him.
Okay, great. Just a clarifying question. So on the app, is there anywhere that reports the weather or the pollution level?
No.
Because I don't use it very often, I'm wondering whether they would give this information to to the user somewhere.
No, for the app, it does not inform.
Okay, and then my second question is also related to this one. It's like whether people would know about this pollution level, because pollution is not something very observable. We could feel it if it's like extreme polluted weather, but to some extent it's not visible. So I'm wondering, do you have some practice or measures to indicate people's perception, awareness of the environmental pollution? Like some people might care about it very much. If they say the pollution level is really high, then they would rather stay home or do some indoor exercise, while other people would do the outdoor exercise anyway. I'm wondering whether this would be incorporated into the study.
Yes, great question. So first, the app does not report and inform people of the pollution level. And second, I totally agree that pollution awareness and perception would be very heterogeneous across individuals, and that is something I also want to document it. Want to document in this research as well. So there are some previous studies, not in economics. They are showing, like, trying to understand how people respond to air pollution. The way is just directly ask them in the survey. If it is heavily polluted, will you change your behavior? And of course, people predominantly say yes. If it is very polluted, I would want to avoid exposure in some way, and physical exercise can be one of them. And that way is kind of contingent on people pay attention to air pollution already. So it might not be the case as like their day-to-day activity. They may just have too many information to care about, maybe just didn't pay attention to air pollution. So for this research, I really document the natural behavior of whether people change their physical exercise in the real world. And it could be some people who pay attention, some people who not. I will show some heterogeneity across neighborhood at different education level. And I also have a survey data which directly measure people's perception of air pollution and to see how that vary by group and how that will change their exercise behavior. But what kind of this data document is like the status quo under the current information system, under people's current awareness of knowledge and education, and what kind of way people are respond to air pollution.
Great, thank you, Yichu.
Okay, thank you. This is a marginal effect. And of course, I think it's a great way to transition to information. And people are always curious about, are people respond because they receive the information? Is the government system of information promotion really work? So as a recall, this is the kind of different air quality index. There are like different suggestion for awareness behavior. And we can see like when above 200 heavy pollution, like they say normal people should reduce and vulnerable people should stop. And other like light and medium pollution, there are some information related to physical avoidance behavior as well. And what I found is that I found a significant reduction in exercise at the heavy pollution threshold. So this is 200. I aggregated data to like city-date level and average pollution when it's above. The y-axis is the share of people doing outdoor exercise. The x-axis is the daily average AQI level. And we see when the air quality index are above 200, the heavy pollution threshold, there seems to be a discontinuous reduction in exercise. And I do this regression discontinuity estimate on the threshold of 200 and also do threshold of like placebo threshold for other threshold beyond this like heavy pollution threshold. I found only for like at the 200, the government designated heavy pollution threshold, I see a discontinuous reduction in outdoor exercise. And because I do not exactly observe the time when people check their phone, like to check air quality, what is the kind of reported air quality level, I only have like daily average air quality level because I don't know, like maybe 8 a.m. they checked, sometime it's above 200, maybe 7 p.m. it's below 200. I don't observe this kind of within the variation in when people check the APP and what was the reported air quality level. So I can also do some robustness check, like do some buffer area around 200 to allow like within day variation in this pollution information. And I found that no matter I do the donut range from 0 to like 15, it's all very significant for the AQI level on heavy pollution threshold, but found like no RDD like result for light pollution or media pollution. Is also again showing that it seems like people discontinue and reduce their exercise when it's surpass the heavy pollution threshold designated by the government. So the information has really played an important role in this adaptation behavior.
Yishin, there's 2 questions by Sean. Sean, do you want to unmute yourself?
Yeah.
Super interesting paper and great work on all the data. I was just curious on, do you know is it like, so I live here in Reno and we know if snow's coming, the next day. So I might go drive the day before to avoid a big snowfall. Do people know a big pollution day is coming? Is there indicator of that? Do I maybe get my run in the day before to avoid pollution?
That's an excellent transition to what I'm going to talk right now. Is there's another unique feature of the China's pollution information system is that the AQI level, you need to check it, maybe similar for US, like you just check on your phone, AQI, Boston, and then you can see what the air quality right now. So it's checked in the real time and reported in the real time. And there's another feature in the alert system in China is that the municipal government of emergency office of cities in China, they will issue an official alert when the daily average AQI is forecasted to be heavy pollution and to be especially when it will last for days. So if it is forecasted, if they will issue like blue and yellow alerts when it's forecasted to be a short term, like 1 to 2 days polluted event. And they will issue orange and red alerts if it will be a long term, like 3 days or longer heavy pollution event. And for the like orange and red alerts, they're required to be issued 24 hours in advance. So it's give people some time to like change their behavior, like prepare to change their behavior. And I see kind of people for these alerts, there are extensive efforts to circulate the alerts, like broadcast, TV, internet, newspaper, Weibo, which is kind of Twitter equivalent in China, and also text messages when it's like orange or red, municipal governments or even sign some like text messages to individuals to tell people like be prepared as a heavy pollution event will happen. So it's much more salient information than you check by yourself. And so I construct a pollution alert database by scraping all the historical posts of the official Weibo of like city governments. And I script that for 2 types of city government posts. The first is just the municipal government itself, like Beijing municipal government, they will have their official post. I also script that for like city level EPA. So because some of these alerts may be issued by the Environmental Protection Agency. I also script that for like city by city. And I use regular expression to identify what level of pollution alert the city issue. And also when would be that's the start day of the pollution sequence and day of pollution sequence. And this is I'll give you an overview of the data set. I found that this is a probability of issuing alert as a Y variable, and the X variable would be daily average AQI at the city day level. And we see like when the pollution level go higher, there are increasing possibility of issuing like blue and yellow alert in blue line and orange and red alert in red line, and the green line would be no alert. So like as the pollution level getting more and more severe, there are increasing possibility of issuing alert. But like even when it's above 200, so actually heavy pollution sequence, there are only less than 1/4 of sequences are successfully predicted. So most of the time it's like people will learn from the air pollution happen and they will get that information, but only less than 1/4 will like government issue some information in advance. And this is the distribution of blue, yellow, orange, red alerts, how many days with AQI above 200 are like as this is city day level, so you'll see like more days than a year, but this is kind of the distribution of the alerts. And I do that is I also tested the events, like if I have a heavy pollution as a dummy variable to see that how that affects outdoor exercise rate. I found like this of course significant reduction in outdoor exercise when it's above 200 heavy pollution, but there is also additional interactive effect when we see the effect of alert. I found that yellow and blue alerts, which is lower level alert and did not issue in advance, does not have a significant behavior change. But like for the red and orange alert, they really like almost doubles the extent of people reduce their exercise. And of course, you might wonder, like for the red and orange alert is kind of issued, for consecutive pollution. So maybe like it's heavy polluted to 3 to 4 days, and the first 1 or 2 days you already get that information is polluted. So the 3rd and 4th day will be more salient to you, even without alert. So I also exclude the consecutive polluted day, just look at the first polluted day. And we still observe this kind of information effect when government issue the red and orange alert. It have substantially increased the likelihood of people to reduce their outdoor physical exercise. And perhaps to direct, I do not have that with me on this main presentation, but I think I have here this one figure to kind of document the effect over time by adding some distributed lag model. And I kind of found that there's contemporary effect is very large, but it's actually 1 day lag, 2 day lag, you still see an effect. And when it's like longer lag, they kind of a small rebound in activity, but it's kind of like much smaller magnitude compared to the contemporary effect. So it's kind of showing some temporal substitution activity. So this might more directly answer your question, but the alert system is to showing you that if you like issue alert in advance and give people time to prepare, it's also will more likely to induce higher adaptation behavior. And plus, yeah, I will speed up a bit. Like the distributional consequences of the results are also quite salient. So individuals in the most educated neighborhood reduce their outdoor exercise by like 28% to 50% when it's like heavy polluted or severe polluted, while those in the least educated neighborhood only reduce that for like 11% and 18% when it's heavy or severe polluted. So it's showing, this is showing the gradient of the green line is the most educated people in most educated neighborhood, and the red line is the least educated neighborhood. We see this like a reduction in pollution, outdoor exercise gradient by pollution level is very salient and increasingly salient as the pollution level go higher. And the left chart is just the marginal effect. They also see this gradient. So education really play a very important role in moderating avoidance behavior. And I found it's kind of the most significant moderator compared to like wealth or like gender, age, etc. And there are several potential mechanisms to explain the inequality in education. The first would be the pollution information. So maybe like policies augmenting pollution information coverage or saliency can reduce this adaptation gap by education group. And what I found is that high educated people like are actually not only more likely to respond to air pollution to begin with, but also more likely to respond to alert system. So increasing the alert saliency of the information does not really bridge the gap. I also tested about some evidence of adaptation capacity, like whether maybe like for the lower income people, lower educated people, they rely on air pollution, rely on like active commuting as a way to exercise because they don't have an automobile. So that if that is the way they do exercise, we shouldn't expect them to change a lot according to air pollution because they need to go to work. And I do that analysis for commuting time and non-commuting time. We see this education gap are persistent no matter which time we're looking at. So even for later time at outdoor exercise, there are also significant inequality across education group. And I also test that for indoor substitution and also found for all groups, I do not observe a significant impact of shifting to indoor exercise as a like adaptation margin for people to resort to so that they can reduce outdoor exercise. And the more likely mechanism explaining this education inequality is their pollution awareness. So to do that, I collected a large-scale survey for like 3,400 individuals in Zhengzhou, a central city in China, with my colleague at Sustainable Urbanization Lab. We visited 95 local companies across 18 sectors around the CBD area of the Zhengzhou, so that we really sample people working and doing activity at, it's a very similar location. So their pollution perception should, in fact, the objective pollution exposure should be similar, but we see that how their pollution awareness are different. And this is the result. We see that for like education 1, 2, 3 would be like, by column 1 to column 3 will be increasing level of education. This will be perceived local pollution severity is much higher, like 1 to 5 Likert scale is higher when like you are more educated. And perceived local air pollution health impact also significant increase once people are more educated. Score of pollution knowledge increase in the monotone relationship, and also whether they get reliable pollution information, which means like from official sources or monitor instead of just by visibility, also increase by education. And also the last column would be self-reported reducing outdoor exercise for pollution avoidance. Again, similar to what I found in the paper. There's by the natural data also observed an increasing tendency to reduce outdoor exercise for pollution avoidance. It's very closely tied to their awareness. And I do a moderate analysis. So when we just do the simple regression on how education affects people's self-reported reducing outdoor exercise, education like with lowest education group as the control, the more educated you are, the more likely you reduce outdoor exercise on polluted day as avoidance behavior. And also like different measure of health impact of air pollution plays a role in increasing like self-protection by reducing outdoor exercise. But when controlling for the awareness channel, we see the relationship between education and like self-reported reducing outdoor exercise disappear. So it's kind of suggested that, although it's just through a survey evidence, but it's suggested that the awareness of pollution health impact are likely to be one of the key mechanisms moderating why people of different education are behaving differently in response to air pollution. And finally, a very back of envelope analysis on the social costs associated with the pollution behavior. I found some evidence from literature like physical inactivity contribute to more than 15% of annual cost of major non-communicable diseases in China, which contribute to the $6.7 billion. And it will be like around $8 billion in 2017. In 2017 US dollar, which is the study year. And I kind of do a counterfactual physical activity under clean air by impute the outdoor exercise rate using the main model, but I change the days with AQI above 25 to 25, and I feed that into the main model I already estimated through the main specification, while keeping value of weather and other control unchanged. And doing this exercise would increase the average physical exercise rate from like 16% to 17.2% for like all individuals in all cities, and which would be about 7% increase. And I use that 7% to feed back into the previous literature, understanding the health costs associated with physical inactivity, and estimate that there will be about $0.55 billion loss in major non-communicable diseases due to air pollution in 1 year, 2017. And if I reweight the population according to the age distribution of the census, I will get $0.5 billion, but it's still a very similar and significant amount. So that's kind of, it's very rough, very back of envelope, but it's showing that the health costs associated with physical inactivity elicited by air pollution should also receive more attention in future studies trying to understand the social costs of air pollution and other environmental hazards. And I will stop here. So the conclusion would be like I found robust causal effects of air pollution on urbanist outdoor physical exercise. I found this could indicate the sizable health costs associated on the pollution irrelevant non-commutable diseases because people reduce their physical exercise. And I found information is the key mechanism which moderates avoidance behavior, yet with very heterogeneous effect across people of different education. And there's of course limitation, as I mentioned very frankly upfront, and this kind of will be some sample selection biases, and I also only have neighborhood level socioeconomic measure. So it's in the future, it should be complement with like other studies, maybe using various other data set, like administrative data set, survey data set, to try to like cross-validate each other to see whether we can improve our understanding of private adaptation behavior and to try to understand this cost. And thank you, and I will answer like remaining comments and questions here, but if there are other questions, please feel free to reach out to my email and I'm happy to answer more there. Thank you.
Thank you, Yishin, so much for a great presentation. We already have some people raising their hand. Malik?
Yeah, no, this is great. I think it's pretty convincing in terms of people adapting to air pollution. I think so. My comments more on the back of the envelope calculation at the end, which I know is meant to be rough, but I guess, do you think you can get a better estimate or sense of what it might be? Because I guess my concern would be the following, which is we're looking at people using this fitness app. These are people that maybe work out once, twice, maybe 3 times a week, and having them work 1 day less a week or something, like they're already pretty healthy versus like taking somebody who infrequently works out and then transitions to never working out because of air pollution. Like that's really the margin where you're going to see these big health effects, is people going from like active to inactive or inactive to active, not people who are active to like a little bit more active.
Yeah, great question. I think what I can improve in this is to do more analysis on people with different observed exercise frequency in the APP, and to observe like their differential adaptation behavior, and maybe link that with the survey data showing like what is kind of the distribution of people's exercise frequency in China, and to kind of match that in some extent to similar to I reweight the age composition according to census. Maybe I can reweight exercise frequency according to the their observed exercise frequency, and also what people are usually doing in the context by survey data, like in the similar context in China, and that I may be able to get to the heterogeneous response by people of different like exercise tendency. But my prior is that I likely to underestimate the way people reduce exercise. If like there are some people, if they don't have the like rigid exercise ritual and to do that every day, and if it is they see higher pollution, they have more likely to say that as an excuse and to not do exercise anymore. So yeah, but I can definitely do more, and I will try to incorporate that into further analysis to make the back of envelope slightly more convincing, I guess, but it's still says it's back of envelope, so it's not that like rigorous to begin with.
Great, thanks.
Thank you.
I don't see more hands raised, but while we get more questions, Yichu, and I had one question, and that is, you did talk about the accuracy of the forecasts and how, you know, basically these warnings that are issued by the government did capture, and you also have independent measurements of pollution, right, besides the warnings. So my question was on whether people only react to these warnings above the threshold. You already showed there was this discontinuity in adaptation, but I was wondering if you can actually see heterogeneity in the exposure to pollution within the city, and if the warnings are issued across the board in a city, then maybe you could decompose how much people are reacting to the perceived pollution and how much they're reacting, and in some cases that would be an overreaction to the health warnings. If the if pollution warnings are issued for the whole city, for example, and you're in a location within the city that is not as exposed, by reducing your exercise, you would be overreacting to the warning.
That's a great suggestion. Yeah, I could test that whether like the warning have an effect when it's kind of inaccurate. This could be like spatially for some location in the city, it did not have like heavy pollution issue, or it could be like on this, it's forecasted to be polluted, but it did not end up with like heavy polluted because of the forecasting error. I could like temporally and spatially, there are kind of two type of like forecasting error, which maybe I can delve deeper into to see the behavior response and to what extent the government alert is really play a dominant role in deciding people's behavior.
Because
Thanks.
you raised two sources of, health impacts, right? One is it's healthy to exercise. The other one is it's not healthy to exercise when it's polluted, right? So there's two sources where if you like on one way, the optimal policy could be to over advertise pollution, and then you have too many people reducing exercise. The other one would be to under advertises and you have too many people exercising. And so it's interesting to see what I'm sure like the policy of advertising a warning for each individual area of the city is costly, but maybe you can test, what the potential benefits of being a lot more accurate in the warnings could be.
Yeah. That's definitely a great suggestion. Whether we want to be more conservative or we want to let people know whenever there's a likelihood to be heavy polluted, just let people know there might be, and that could cause people to over adapt and maybe like affect their other like local daily activity, and that without considering this potential spillover health costs, we might feel like it's very low cost. We just let people know, that people have the information, let them to protect in a way which is kind of always beneficial. But if we consider the spillover health impact, that kind of have different implication to whether we should over advertise or not. That's definitely a great suggestion.
There was a remaining question, I think, from Sean, right? That when you talk about the Los Angeles people, Sean, I don't know if you wanted to revisit that.
Yeah, I think there are two many questions. People may choose the days and time to exercise according to pollution forecast. Also, this already mentioned.
Yeah, so he, like right after that, he asked about if you knew where people grew up. That
Yeah, I'm
they were
thinking like
overreacting.
Los Angeles, people grow up with pollution, so maybe more used to it and go out more on pollution day than people who are not used to it. That's also interesting. I don't think I know people where people grow up, but I think there's still variation to see people living in a heavy polluted city versus people in cities which are not that polluted. So if we think like people already, so there are kind of two like direction. I don't know which will go. Like from my prior knowledge, the first direction is that people who used to live in heavy polluted city, they are like so accustomed to that, so it's going to be polluted tomorrow as well. So I have no chance to exercise, so I should keep exercise even if heavy polluted. Alternatively, people may have higher pollution awareness, knowing better of the health consequences of air pollution because they just experience that more and more. So they may be more health conscious and more likely to reduce. I don't know what direction we'll go, but yeah, I can definitely test for people in cities with different carbon pollution level, how their adaptation behavior differ. I think that would be an interesting thing to explore, but I don't have a prior knowledge of what's the direction we're likely to go.
One alternative way to address that type of story of exposure would be to look at, which I think maybe it's easier to find in your data set, is to look at occupations. If one could think of people that spend their day in an office or spend their day indoors and therefore being pretty much shielded from pollution all day, versus other people whose occupations force them to be outdoors. And so maybe, if you're going to be outdoors all day anyway, again, I agree with you. We don't know what direction that would be. Maybe you don't want to be even more exposed, or maybe you think, I'll be outside all the time anyway. But that would be a nice thing to see, to visit this idea that is so important on inequality and heterogeneity of the impact.
Yes, definitely, totally agree. Great.
So I think we don't have more questions and we're almost on time. So I wanted to take this opportunity to mention two things. The first one is that as you probably all know, I'll be taking over as the chair of the seminar for this upcoming season, and I'm going to be using my Gmail account to handle all the information for the seminar. So I just put it in the chat, and David kindly sent a recent email from his account to notify everyone of where the emails are going to be coming from, so that you add me to your safe senders list. And the other thing is to tell you about the upcoming seminar on February 28th. We're going to have May Rostam from the Bank of England presenting price discrimination and mortgage choice. So I look forward to seeing you there. Thank you so much, Yichu.
Happy Valentine's Day again to everybody still here.
All right.
See ya.
Perfect. Bye.